Hello, I'm Dr. Ramsey Amin, BurbankDentalImplants.com blog. I'm going to speak with you a little bit about today what to expect after having a dental implant bone graft. I receive a lot of questions on a daily basis on what's normal healing, what should I be concerned about, what's a membrane, a lot of confusion out there and maybe some miscommunication. The basics of any bone graft require a healing time. Bone by nature is slow to heal. It takes some time. It heals slower than your skin would. And after having a bone graft, it's important to follow all the directions that your surgeon gives to you. There are many different kinds of bone grafts. There's ones that are just little tiny bone grafts like this, and there's ones that are fairly substantial. We can be replacing bone just around a corner of a dental implant, around a thread that might be exposed at the time of placement, or we can be replacing the entire bone within the sinuses, the entire outer wall of bone. We could be taking bone the size of, say, a Triscuit cracker and screwing it in place with bone screws to your jaw. So those are be considered bigger bone grafts, while smaller bone grafts may be in and around the teeth or around smaller areas of implants. A common bone graft is a socket bone graft. That means that a tooth is extracted and bone is implanted directly into the socket to maintain or preserve the space from shrinking. It's very beneficial in many cases, especially in the upper front part of the mouth, or anywhere in the front part of the mouth especially. Bone grafts are going to heal with some degree of swelling, some degree of redness, and some degree of pain. Every dentist and every patient is a little bit different in the way these heal, but the basics are, if you had, say for instance, a socket bone graft, which is extremely common, it's not uncommon to lose some particles from the top of the bone graft. The bone graft has the consistency, or the material mostly that I would use would be the consistency of, say, oatmeal or granola. It has its particles. So oftentimes we'll overfill the socket, and that doesn't get taken inside the gum may find its way to the surface. You may feel like a sharp piece coming out, and that's not uncommon. Usually that's covered over with a membrane, either of collagen or Gore-Tex or something called EPTFE. There's different types of covers that would go over the top to help maintain that in. In a socket bone graft, having a membrane that's exposed is not a bad thing. The cover cannot completely cover your teeth because it was a socket before. If you were to extract the tooth, it would be a large hole. In a larger bone graft, let's say when we're doing an onlay block bone graft or a sinus graft, it's really important that we have no bone exposure. The membrane or the cover remains completely submerged underneath the gum, and the stitches are very tight with no exposure. And because that's a bigger bone graft, its healing capability is not as good as a socket, so its healing is different. It's hard to explain this for each and every type of bone graft, but keep in mind that if you do lose a bone particle or two, it's not a big deal typically. If you're having a block bone graft or a sinus bone graft and there's bone coming out, or the stitches became open, the wound opened up, those are bigger deals that you want to see your dentist on a ASAP basis. Antibiotics are fairly common after having a dental bone graft. The larger the bone graft, typically the longer period of time that you'll be on the antibiotics. Again, my name is Dr. Ramsey Amin, BurbankDentalImplants.com. Thanks for watching.